Welcome to the State of Hawaii Title V Priorities Summary. This is the fourth year of a 5-year project period. Let's take a look at our priorities, evidence-based and informed strategies and innovations, and accomplishments for federal fiscal year 2018 and plans for 2020. Based on the 2015 needs assessment, Hawaii selected at least one priority health issue for each of the 6 Title V population domains, moving across the life course. For women and maternal health, Hawaii selected promotion of reproductive life planning. For perinatal infant health, reducing infant mortality through breastfeeding and safe sleep promotion. For child health, developmental screening targeting 0 to 5-year-olds, oral health, and the prevention of child abuse and neglect. For adolescent health, the focus is to improve health, safety, and well-being through annual wellness visits. And for children with special health needs, the focus is transition from youth to adult healthcare services. For the optional cross-cutting and systems building domain, the priority selected is to improve the use of telehealth across FHSD programs. Priority 1, promoting reproductive life planning. Using evidence-based strategies to encourage the use of long-acting reversible contraception as part of reproductive life planning. And the one key question, would you like to become pregnant in the next year? To encourage preconception healthcare visits. Systems building work is conducted through collaboration with partners. The Hawaii Maternal Infant Health Collaborative, a statewide private-public partnership, continues to lead efforts in this area. The collaborative achieved major success in 2018 when the state Medicaid program issued a new policy to expand contraceptives coverage, including improved reimbursement and stocking of LARC at birthing hospitals, and support training for OKQ use as the standard of care. The collaborative is now working on implementation of this guidance. Future plans include continuation of OKQ provider training, evaluation of the new Medicaid provider policies, and the development of public awareness messaging on healthy behaviors to support reproductive life planning and preventative women's healthcare visits. Priority 2, promote breastfeeding. One priority for reducing the rate of infant mortality is to increase the percentage of WIC infants ever breastfed at hospital discharge and duration through 6 months after birth. Since the WIC program is the largest public breastfeeding promotion program, serving half the births in the state, the key strategies focus on strengthening WIC breastfeeding programs, including the mother-to-mother peer counseling breastfeeding program, and increasing partnerships with community-based organizations to expand WIC services to underserved populations. In addition, broader systems building activities are being implemented throughout statewide collaboration and networking. Working with the Hawaii Maternal Infant Health Collaborative, a state breastfeeding strategic plan was completed in 2018. WIC co-convenes a team of partners who are securing resources to implement priority projects of the plan while continuing its successful breastfeeding peer counselor project, which provides group and personal supports to WIC moms. Moving forward, the state breastfeeding work group will focus on 3 projects. Conduct training for providers on insurance reimbursement for lactation support services available under the Affordable Care Act. Develop training on cultural and indigenous approaches to breastfeeding, and expand the Peer Counselor Project to Hawaii Island. Priority 3, reducing infant mortality through safe sleep. In fiscal year 2018, the focus for safe sleep promotion was to ensure Hawaii's birthing hospitals established policies and protocols, develop appropriate and consistent educational messages, and assure training and adequate resources to all family service providers. Accomplishments include the successful adoption of safe sleep policies and protocols that follow the American Academy of Pediatrics recommendations at all 12 of Hawaii's birthing hospitals, and partnering with the State Child Care Licensing Agency to develop educational materials for mandated safe sleep training of all licensed child care providers. The materials were also shared with other family service agencies, including WIC and home visiting programs. Future plans include expanding outreach to non-English speaking families by translating safe sleep educational materials into the 10 most common languages spoken in the state. This project is a partnership with the State Office of Language Access and the State Child Care Licensing Agency. Workforce training will continue through the annual Safe Sleep Summit, which convenes statewide agency and community partners to share information and coordinate efforts. Priority 4. Increase developmental screening and services. The priority for developmental screening is to increase the number of children receiving developmental screening and services through policy and public health coordination, systems development, data integration, and family engagement. Guidelines on developmental screening, referral, and services were completed with stakeholder input and disseminated to the state early childhood community. Partnerships continued with state early childhood organizations to promote a system of developmental screening and referral. FHSD contracted with the University of Hawaii to create a data system to capture the number of children screened, referred, and receiving services on Maui as part of the Federal Early Childhood Systems Grant. Data is used to monitor and improve screening and referral activities among programs. Our plans moving forward are to continue work with partners from early childhood and healthcare sectors to ensure a system is developed to prevent children from being overscreened and receive any needed support and services. Priority 5. Improving oral health of children. The two strategies are building the state oral health program, including assuring leadership, data surveillance, partnership development, and state planning, as well as completion of a teledentistry pilot project at WIC, Head Start, and preschool programs. FHSD completed work on the 5-year CDC oral health grant, including the Head Start and Early Head Start oral health screening survey, completion of an oral health community plan based on a year-long community input process, which was comprised of town hall meetings, stakeholder surveys, and a statewide conference, and sustainment of the State Oral Health Coalition. The pilot virtual dental home teledentistry project led by the department's Developmental Disabilities Division successfully demonstrated that the program is a sustainable and cost-effective service model with Medicaid reimbursement. The project reached 471 children with 631 dental exams. Future plans include publishing of the Head Start and Early Head Start survey report. FHSD is currently working with stakeholders to develop actionable recommendations. FHSD did not receive continued funding to sustain the oral health program and is exploring methods to support future staffing. In the meantime, oral health work continues through the SOHC. Priority 6. Reducing the rate of child abuse and neglect from ages 0 through 5 years. Strategies are to promote safe, healthy, and respectful relationships through public awareness, state planning, surveillance, coordination, and workforce training. The Hawaii's Maternal, Infant, and Early Childhood Home Visiting Program continues to provide evidence-based services. Working with the Hawaii Early Childhood Action Strategies Collaborative, technical assistance from the National Frameworks Institute was secured to complete a 5-year communication plan designed to increase awareness about family violence and promote safe and healthy family relationships. The CAN Prevention Program joined a new partnership with the Child Welfare Services and the Hawaii Judiciary to develop the next state 5-year Child and Family Services Plan. The Hawaii Evidence-Based Home Visiting Program made 9,714 home visits to 811 families across all 4 counties. The Family Violence Communications Plan will be implemented with the development of a messaging campaign. The Child and Family Service Plan will be completed. A data surveillance work plan will be finalized and implementation begun. Home visiting and workforce training services will continue. Priority 7. Improve the development, health, safety, and well-being of adolescents. Adolescent health promotion efforts are focused on collaborating with teens, youth service providers, and community health workers to develop and disseminate informational resources to promote access to adolescent preventative services. Corresponding workforce training will be conducted to enhance the knowledge of youth and community health workers who can link teens to primary care providers. Title V is designing an adolescent resource toolkit to provide health information, including the importance of wellness visits, for adolescents in youth service and community health workers. The ART was revised based on input from teens in the Personal Responsibility and Education program, as well as community health workers linked with rural, federally qualified health centers. Workforce training efforts on healthy youth development targeted providers working with at-risk youth in youth detention and correctional settings, helping to ensure physical assessments are provided upon entry to these facilities. Plans include training of community health workers in rural areas on the ART to provide health information to adolescents, conduct simple assessments, promote the importance of wellness visits, and link teens to services. The program will also continue to collect input from adolescents and providers on the ART to assure its effectiveness. Priority 8. Promote transition to adult healthcare. The major strategies for this priority are standardizing procedures and data collection for transition in the Children with Special Health Needs program, using the evidence-based 6 core elements of healthcare transition, promoting statewide education and awareness, and integrating transition services into the standards of care for community programs and agencies via collaborations. In the past year, the transition policy and protocols have been implemented and evaluation is ongoing. The new database is nearly completed, allowing for tracking of clients' transition plans, and annual transition fairs and presentations were conducted in partnership with state and community agencies serving youth and their families. Plans include further evaluation of the transition materials and protocols based on family and staff input, completion of the CSHN program database so transition can be tracked, and continued support of education and public awareness events with agency partners. The CSHN program and the Title V Adolescent Health Program are participating in an MCH Workforce Development Center TA cohort to increase outreach to all adolescents. Priority 9. Increase the use of telehealth. Strategies for increasing the use of telehealth are workforce training, infrastructure development, and provision of services, education, and training. Online and in-person telehealth training has been conducted, and telehealth services are being provided through several Title V programs, including genetics, newborn screening, early intervention, WIC, and home visiting. HSD offices statewide continue using the technology for meetings and provider education, including Project Echo Hawaii, used to build the primary care workforce capacity, targeting providers in rural communities. Next steps and plans focus on 4 areas: telehealth infrastructure development, workforce development training on telehealth applications and skills, direct service provision using telehealth, and education and training programs using telehealth resources.